Hello, Shemai. My name's Julie Browne. I'm the lead for the Intercalated degree in Medical Education. So I expect you're wondering why you should do this course. Teaching is an absolutely central part of a doctor's job, and it's absolutely vital to preserve patient care for the future. If you think about it, teachers make a tremendous difference to your experience at medical school, but they also influence how you'll practice in future. However, we don't just chuck the medical curriculum together. Medical education is an evidence-based subject. It's been an academic discipline for over 50 years, and there's a large weight of evidence about what works, in what circumstances, for whom, and why. What will you study on this course? Well, we have 5 main modules, and they're all compulsory. The first is research methods. Obviously, you're going to need to know about research methods in order to do your research project, but you need to know about research methods so that you can appreciate and understand the literature that you're going to be reading. There's also a course called Foundations of Medical Education, in which you'll be learning about the basics of educational theory, educational practice, how it's developed, how it's organised and structured, and how medical education is assessed. The third module is the social, historical and contemporary context of medical education. This is the part of the course where you'll begin to bring together some of what you've been learning in the other modules to consider the place of the patient in medical education, how medical education got to be the way it is today and what it might look like in the future. The fourth module is learning environments. People often enjoy this one because it involves developing learning materials. You'll be teaching, you'll be designing an e-learning package, and you'll be preparing your portfolio of teaching for the future. Finally, the research project. And the research project is 40% of the overall marks. And this is the part of the course where you'll work with medical education researchers from the Centre for Medical Education on various projects to do with how medical education is designed and delivered and assessed. In the past, medical education research projects that students have undertaken have included things like how are our graduates prepared for practice? Widening participation, how can we make our medical workforce more representative? Interprofessional education, assessment, how it works. So if you like qualitative work, that's the project for you. Careers, rural medicine and how rural medical education takes place, the place of Welsh in medical education, assessment methods, learning technologies and interprofessional education. How's the course assessed? Well, you'll be glad to know that there aren't that many exams, just the one in research methods. But we're medical educators, so of course we want to try out all sorts of different assessment methods to be sure that we've got a really good picture of how you're learning and developing. So you'll be assessed on presentation skills, you'll be assessed by short essay questions, by medium-length essay questions, and of course by the work that you do in the research project. You'll also develop a teaching portfolio, and you'll have experience of presentations and group work. Why will you enjoy it? Well, there's a good question. We have a lot of feedback from previous students who've really enjoyed the opportunity to delve more deeply into their experiences at medical school and what the future might hold for them. They like the field trips, they like the practical work, they really enjoy the very open discussions that take place, especially during the social, historical and contemporary context of medical education module. They like the group work, they like working in teams. Many of them are very pleased that they develop critical research skills and that they're able to appreciate the evidence more effectively. And of course, the actual research method skills that they develop are a lifelong resource for the future. You'll like the field trips, and we have plenty of opportunities for working with people on publications and presentations. The medical education community is a really open, friendly bunch of people, and of course, To some extent, as medical students, you already know a great deal about it, so you'll be very welcome among the academic research community if you join this course. There are also opportunities for collaboration with students and teachers from other courses around the UK. We have good links with Imperial and with Leeds. Finally, and most importantly, how will studying medical education affect your career? Well, we already know, because the course has been running for 5 years, that medical students from our course go on to do a variety of things. Many of them, of course, continue their involvement in teaching. While they're on the course, they develop a great love for medical teaching, and as soon as they get into foundation, they can't wait to get involved again. They also develop research skills, and we have close links with some of our alumni who are continuing to work with us on research projects, which is great fun, and it's lovely to keep in touch with them. A large number of our students go on to the academic foundation programme because they want to continue their research and also because they want to continue to teach. Bear in mind that if you want to become a Dean of Medical Education or a Leader of Medical Education, then obviously you'll get a kickstart by having an early degree in medical education. One thing that's very important in medical education is that you've got lots of experience of it and that you've shown your commitment to it throughout a long period. Many of our students go on to become Fellows of the Academy of Medical Educator and also of the Higher Education Academy. And again, knowing something about medical education and how it works is a tremendous bonus when you're applying for these types of fellowship. So to conclude, I do hope that you'll want to come and do this course with us. We have a great time. We enjoy all of the opportunities that we have to offer, and we really want keen and enthusiastic students who are willing to really share our values around education and educational development. Thank you. Diolch yn fawr.